Today we're going to talk about how you can double the speed of skin healing and be back on the project in half the time. Today I'm here at my wintertime location. It's a deep winter session. I'm at the Hospital Hill Cave. We have had a week of double-digit negative temperatures, so the rock right now is colder than ice. As I've mentioned previously, in these sub-zero conditions with the very cold rock, the skin becomes very hard and non-pliable, which allows it to tear off in huge sheets at the dermal epidermal junction. That is the layer between the dead cells of the epidermis and the living tissue underneath. What happened to me is I was grabbing an edge and my pinky finger was rolling across and the skin just disconnected and a huge chunk has come off my fingertip. When it comes to the principles of wound healing, skin reepithelializes from the edge in towards the center at a fixed rate depending on the body location. However, any sort of mechanical disruption or washing your hands, general wear and tear, will slow down this reepithelialization. As well, some people think that the wound should be kept dry. This is exactly the opposite. Optimal wound healing occurs in moist conditions. It allows those new cells to crawl in towards the center. A world-renowned plastic surgeon, Dr. Lalonde, who mentored my partner, has a saying he used with patients. If the wound gets dry, the cells die and they cry. Dry, die, and cry. So in order to achieve optimal wound healing conditions in the medical context, we use a variety of substances that we apply and then regular bandage changes to deal with the exudate, which is the fluid that wounds excrete. One approach that would speed wound healing on your fingertips would be to apply Vaseline every hour, on the hour, round the clock. This is neither convenient nor practical, and so fortunately we have a better technique. This one trick will get you back on the rock in half the speed. You'll be able to wash your hands with soap or rubbing alcohol with no discomfort, and the stinging that's associated with the skin tears is gone instantly. Number one is if you have a big flapper, just cut it off. It's not doing any good at this point. So I trim the excess skin with a small pair of scissors. Next, I get the hydrocolloid patch. These can be obtained online very cheaply in convenient small circles that people use for facial blemishes. I apply the hydrocolloid patch to the finger and then glue around the edges to get a longer lasting seal. You can keep this on for as many days as it'll stay in place until one of two things happen. Either it starts peeling up and is no longer functional, in which case just repeat, or it gets totally soaked with fluid from the wound, in which case, again, just replace. And that's it. This has been an absolute game changer for getting me back on the rock. It can be used on any size of skin tear on your hands and will work just as effectively. Small punctures all the way up to giant flappers like I have here today. It'll get you back on the rock in half the time. When you are nicely epithelialized, that is, the skin has grown completely and covered the wound, I leave it on for an extra day, basically until it stops oozing through that thin layer of skin, and at which point, remove the dressing and you're good to go. Make sure you tape that injured area until the skin is completely healed, or else you can get a recurrent tear in the same spot, and that's just super annoying. And that's it. That's how I deal with these bad flappers.